January 23, 1945. Camp Butner, North Carolina. The morning air carried the sharp bite of winter through the barracks, and with it, the metallic tang of fear that no amount of disinfectant could mask. Dr. Carl Weber stood before the small mirror in his assigned quarters, fastening the last button of his Wehrmacht Medical Corps uniform, now stripped of all insignia except the Red Cross armband that marked him as both healer and prisoner. His reflection showed a man of 38 years who looked 50, hollow cheeks, eyes webbed with exhaustion, hands that trembled slightly from 3 years on the Eastern Front, followed by the chaos of the Ardennes. But those hands were steady when they held a scalpel. That was all that mattered now. He picked up his stethoscope, the one piece of equipment the Americans had allowed him to keep. Its weight felt like an anchor or perhaps a talisman. The rubber tubing was cracked in places, the chest piece scratched from being dropped on frozen ground in places whose names he tried not to remember. Minsk, Stalingrad, Bastogne. Each scratch a story, each story a life he had tried to save, or a death he had witnessed. The stethoscope had heard the final heartbeats of young men in German gray and American olive drab alike, had pressed against the chests of children in Polish villages and French farmhouses, had distinguished the wet rattle of pneumonia from the labored wheeze of tuberculosis in field hospitals, where the only light came from kerosene lamps and the only heat from bodies pressed together. Weber's hands did not shake as he placed the stethoscope around his neck. They never did when duty called. Outside his window, the camp sprawled across 2,000 acres of red clay and pine forests, a temporary city of 20,000 German prisoners of war. From this distance, it looked almost peaceful, neat rows of whitewashed barracks, a water tower gleaming in the weak January sun, guard towers that seemed almost quaint compared to the concrete bunkers of the Siegfried Line. But Weber knew better. Peace was an illusion, maintained by barbed wire and armed sentries. Peace was what you told yourself when you woke up each morning still breathing. A sharp knock interrupted his thoughts. Herr Dr. Weber. The voice was young, uncertain. Private Hans Richter, a 20-year-old farm boy from Bavaria who had been captured during the same offensive that had brought Weber to this place. Captain Morrison wants to see you, right away. Weber turned from the mirror. Richter's face was pale and not from the cold. What is it, Hans? I don't know, sir. But there are ambulances, many ambulances, and men in white masks. Something cold settled in Weber's stomach, a sensation he recognized from the war. The sixth sense that told a surgeon when a wound was worse than it appeared, when gangrene was setting in beneath seemingly healthy flesh, when death was already in the room before you could see it. He followed Richter across the compound. January in North Carolina was nothing like January in Russia. No 40-below winds that froze your breath in your lungs. No snow that buried supply trucks and turned every step into a battle. But the cold here was damp, insidious, seeping through clothes and into bones. It was the kind of cold that bred sickness. As they approached the camp's medical facility, a converted tobacco barn that had been equipped with 50 beds, sterilization equipment, and a small surgical theater, Weber saw what Richter meant. 3 ambulances idled outside, their exhaust forming white clouds in the frigid air. Orderlies in surgical masks carried stretchers with a haste that spoke of crisis. Through the building's windows, he could see nurses moving with the controlled urgency of professionals confronting something terrible. Dr. James Morrison waited at the entrance, a surgical mask dangling from his neck. He was 45, silver-haired, with the bearing of a man who had served in the First War and knew exactly what another war cost. Weber had met him only once before, during his initial processing as a prisoner. Morrison had been curt but professional, asking about Weber's medical training, his experience, his specializations. Now Morrison's eyes held something Weber had not seen in them before. Fear mixed with desperate calculation. Dr. Weber. Morrison's German was adequate, though heavily accented. Thank you for coming quickly. We have a situation. Jawohl. Weber responded, then switched to English, his own accent thick but comprehensible. I see this. What is the disease? Morrison's jaw tightened. For a moment he seemed to struggle with the words, as if speaking them would make the nightmare more real. Bacterial meningitis, he said finally. We had the first case 3 days ago. A guard. We thought it was isolated, transferred him to Fort Bragg. But this morning, 18 more cases presented, 12 prisoners, 6 more guards and medical staff. High fever, severe headache, nuchal rigidity. 3 are already comatose. Weber felt the world narrow to a pinpoint of clarity. Meningitis. The word itself was a death sentence in 1945. Before sulfa drugs and penicillin, the mortality rate approached 90%. Even with treatment, it killed more than half its victims, and it spread like wildfire in close quarters, barracks, ships, camps. Anywhere men lived, shoulder to shoulder. How many prisoners in camp? Weber asked, his mind already calculating. 19,643 as of this morning's count. And American personnel? 1,200 guards, medical staff, administrators, support personnel. 20,843 human beings. A small city, a perfect incubator for epidemic. You have serum, Weber asked, sulfonamides, penicillin. Morrison's expression was answer enough. We have some, not enough. Fort Bragg is dealing with their own outbreak. They can't send supplies. The nearest hospital with adequate stocks is in Richmond, 200 miles north. Even if we could get emergency shipments, it would take days. We have maybe 72 hours of medicine at current infection rates. After that. He didn't finish. He didn't need to. Weber understood immediately why Morrison had summoned him. The American doctor was about to do something that could cost him his career, possibly his freedom. He was about to ask an enemy prisoner, a German, a member of the army that had started this war, that had committed atrocities across Europe, to help save American lives. The silence between them stretched like a wire pulled taut. Through the medical facility's open door, Weber could hear the sounds of suffering, moans, retching, the urgent voices of nurses, the mechanical hiss of oxygen equipment. Those sounds spoke a language that transcended nationality. Morrison met his eyes. You trained in Munich, yes, under Professor Kolle at the Institute for Infectious Diseases. Weber nodded. Ernst Kolle had been one of Germany's foremost bacteriologists before the war, a pioneer in vaccine development and epidemic control. Weber had spent 2 years under his tutelage, learning the microscopic architecture of disease, the protocols for outbreak containment, the emerging science of antibiotic therapy. Then you know more about this than anyone in my staff, Morrison said bluntly. You've seen outbreaks. You've treated them. You published papers on sulfonamide protocols for meningococcal infections in 1942. I read them before the war. You know the German research on penicillin dosing that we're still trying to figure out. Weber said nothing. Morrison was right, of course. German medical research, even in wartime, had made significant advances in bacteriology and antibiotic therapy. The Wehrmacht's need to keep soldiers alive had paradoxically accelerated medical knowledge. Weber had treated meningitis cases in Russia, where outbreaks swept through the overcrowded field hospitals with terrifying regularity. He had learned through trial and error what the textbooks couldn't teach, the precise moment when a patient tipped from recoverable to dying, the subtle signs of increased intracranial pressure, the optimal combinations of drugs when supplies ran short. I need your help, Morrison said simply. The words seemed to cost him something. I'm not asking as an American to a German. I'm asking as one doctor to another. Men are dying. Some of them are your countrymen. Most of them are mine. But they're all human beings first. Weber looked past Morrison into the medical facility. Through the window, he could see a young man, American, probably 19 or 20, thrashing on a bed while 2 nurses tried to hold him steady for a spinal tap. The boy's back was arched in opisthotonus, the characteristic rigid posture of meningitis as the infection inflamed the membranes around his brain and spinal cord. His mouth was open in a silent scream. In that moment, Weber saw every patient he had ever treated, every soldier whose life had slipped through his fingers despite his best efforts, every child in occupied territories who had died because medicine and politics had become inseparable. He saw the young SS officer at Bastogne who had ordered him to abandon wounded American prisoners to the snow, and he saw himself handing over his sidearm, saying words that had seemed impossibly naive, but were the only truth he knew. Ich bin Arzt. My oath is to heal, not to kill. I will not leave wounded men to die. That decision had saved his life. The Americans he had refused to abandon became his protectors when the Wehrmacht collapsed. They had vouched for him, testified that he was different, that he had treated their wounded with the same care he gave German casualties. That testimony had kept him out of a grave and put him on a ship to America instead of a firing squad wall. Now Morrison was asking him to make the same choice again. "Show me the patients," Weber said. The smell hit him first when he entered the medical facility, a miasma of sweat, disinfectant, vomit, and something else, something sweet and rotten that Weber recognized instantly as the scent of critical illness. It was the smell of bodies beginning to fail, of metabolic processes breaking down under the assault of infection. In the war, he had learned that smell meant you had hours, not days. The facility was chaos controlled by discipline. Nurses moved between beds with practiced efficiency, checking temperatures, administering medications, recording vitals on clipboards. But Weber could see the cracks in their composure, the too quick movements, the eyes that lingered a moment too long on each patient as if memorizing faces, the way one young nurse's hands shook as she prepared an injection. Morrison led him to the first bed. The patient was an American corporal, maybe 25, his face flushed crimson with fever. His hospital gown was soaked with sweat. Every few seconds his body convulsed with shudders. "Private First Class Robert Chen," Morrison said, reading from a chart. "Age 23, guard duty, barracks 12. Symptoms started yesterday morning with headache and fever. By last night he couldn't tolerate light or loud sounds. New call rigidity presented at 0300 hours this morning. Temperature is 104.6. We've started sulfadiazine, but..." Weber leaned over Chen, his stethoscope already in his ears. The young man's breathing was rapid and shallow. Weber checked his pulse, 130 beats per minute, rapid and thready. He gently attempted to flex Chen's neck forward. The muscles were rigid as wood, and Chen cried out in pain. "Koenig's sign?" Weber asked. Morrison nodded grimly. "Positive. Brudzinski's sign, too. Lumbar puncture showed cloudy cerebrospinal fluid with elevated protein and decreased glucose. White cell count of 42,000 cells per milliliter. Gram stain shows gram-negative diplococci. Neisseria meningitis. The meningococcus bacterium. It was one of the fastest killers, Weber knew. Once symptoms appeared, death could follow in as little as 12 hours if left untreated. Even with treatment, the bacterium could ravage the brain and spinal cord, leaving survivors deaf, blind, or brain damaged. Weber moved to the next bed, then the next. Each patient told the same story: sudden onset of fever and headache, progression to neck stiffness and photophobia within hours, deterioration into delirium and coma. Some were guards, young American men who had probably thought their greatest danger was boredom. Others were German prisoners, including several Weber recognized from the barracks. At the sixth bed, he stopped. The patient was a German corporal named Friedrich Brandt, a former school teacher from Heidelberg who had been conscripted in 43. Weber had played chess with him twice. Brandt had talked about his wife, Anna, and their 3-year-old daughter, Greta, whom he had seen only once in photographs. Now Brandt lay unconscious, his breathing labored, his face a death mask. Petechiae, tiny purple hemorrhages from broken capillaries, dotted his skin. That was a bad sign. It meant the infection was causing disseminated intravascular coagulation, a cascade of blood clotting that could lead to organ failure. "He's in septic shock," Weber said quietly. "The infection is in his bloodstream. Do you have vasopressors?" "Norepinephrine." Morrison shook his head. "Limited supply." We're rationing them for the worst cases." "He is the worst case," Weber said sharply. "Without pressure support, his organs will shut down. You have maybe 6 hours." He continued through the ward, examining each patient with the methodical precision his training had instilled. As he worked, part of his mind cataloged the clinical details, while another part calculated the larger picture: 18 cases in one day. If the infection rate followed typical outbreak patterns, they could expect doubling every 48 hours. 36 cases by day, 3. 72 by day, 5. Within 2 weeks, they could have 1,000 infected, and with a 60 to 70% mortality rate, 600 dead, maybe more. He returned to where Morrison waited, surrounded now by the American medical staff: 3 doctors, 2 Army nurses, 1 Navy corpsman on loan from a nearby base. They looked at Weber with expressions ranging from skepticism to desperate hope. One of the doctors, a young lieutenant with wire-rimmed glasses, made no effort to hide his hostility. "You're going to trust a Nazi to handle this," the lieutenant said to Morrison. "For all we know, this is sabotage. Maybe he brought the disease here deliberately." Weber met the lieutenant's eyes steadily. "Meningococcus does not distinguish uniforms, Lieutenant. It is carried in the nasopharynx of healthy humans, perhaps 10 to 25% of any population. Under certain conditions, close quarters, poor ventilation, winter weather, it transforms from harmless colonizer to lethal pathogen. This is not sabotage. This is biology." "He's right, Coleman," Morrison said wearily. "The bacteriology matches naturally occurring outbreaks. Besides, we don't have the luxury of suspicion. We need every trained hand we can get." He turned to Weber. "Tell me what you need." Weber took a breath. This was the moment. He could play it safe, offer cautious suggestions, maintain the boundary between prisoner and captor. Or he could do what his training, his experience, and his conscience demanded. "I need full authority over patient care," he said. "All of it. Treatment protocols, drug administration, isolation procedures, staff assignments. You can oversee, you can question my decisions, but in the moment my orders must be followed without hesitation. Epidemic control requires military discipline. Discussion is death." The silence that followed was profound. Morrison's staff stared at him as if he had suggested putting a loaded gun in the hands of an enemy soldier, which, in a sense, he had. He was asking for power over American lives, the power to allocate medicine, to decide who received treatment first, to control the response to this crisis. Morrison studied him for a long moment. Weber could see the calculation happening behind the American doctor's eyes. Risk versus reward. Protocol versus pragmatism. Career versus conscience. "You'll work under my supervision," Morrison said finally. "I want reports every 4 hours. Any fatality, any critical change in patient status, you inform me immediately. And if I see anything that makes me question your judgment, this arrangement ends. Understood?" "Understood." "Then God help us both." Morrison extended his hand. Weber shook it. The handshake was firm, brief, and sealed a pact that would have been unthinkable 4 months earlier, when these two men had been enemies on a battlefield. Now they were allies against a foe that cared nothing for flags or ideologies. "First priority," Weber said, his mind already organizing the campaign ahead, "is isolation. We must separate the infected from the healthy, and we must do it now before evening count. The barracks are overcrowded. How many men per room?" 40 to 60 per barracks, Morrison replied. Weber winced. "That must end. Maximum 20 per room, preferably fewer. I need a separate ward for meningitis cases only. Anyone showing symptoms, fever, headache, neck stiffness, gets immediately isolated. No exceptions, no delays." "We can use Warehouse 7, Morrison said. It's been converted for overflow medical storage, but we can clear it out, set up beds." "Good. I need it operational by nightfall. Second priority, prophylaxis for contacts. Everyone who has had close contact with an infected person receives sulfadiazine immediately. That includes guards who worked in affected barracks, prisoners who shared bunks, all medical staff treating these patients. "We don't have enough sulfatazine for prophylaxis and treatment," one of the nurses interjected. "We're already rationing." "Then we ration smarter," Weber said. "Treatment requires high doses for 7 to 10 days. Prophylaxis needs only a small dose for 3 days. We prioritize prophylaxis for high-contact personnel, guards who work multiple barracks, medical staff, food service workers. They are the vectors who can spread infection across the entire camp." He turned to Morrison. "You mentioned penicillin. How much do you have?" 40,000 units total, maybe enough for 5 patients at standard doses." "Standard doses are wrong for meningitis," Weber said flatly. "I have seen this. The blood-brain barrier prevents adequate penetration of penicillin into cerebrospinal fluid at normal doses. You need massive doses, 2 million units per day, administered every 4 hours. Intramuscular injections, alternating sites to prevent abscess formation." Morrison's eyes widened. 2 million units. That would exhaust our entire supply treating one patient. Yes, but that one patient lives. At lower doses, the penicillin suppresses the infection temporarily, but does not eradicate it. The patient seems to improve, then relapses and dies when the treatment ends. I have seen this pattern 6 times on the Eastern Front. High-dose penicillin is the only protocol that works consistently. How consistently? Weber met his eyes. 80% survival if treatment begins within 48 hours of symptom onset. 50% if within 72 hours. After that, the odds worsen rapidly. Morrison absorbed this. So we can save maybe 4 patients with our current penicillin supply, assuming we get to them early enough. Unless we can get more. I told you Fort Bragg can't help. Richmond is days away, even with emergency authorization. Weber was quiet for a moment, thinking. What about pharmaceutical companies, research hospitals? Surely there are penicillin stocks in university laboratories and clinical trials. They're all in the same situation we are, Morrison said. Limited supply, high demand. The war in Europe is still consuming massive quantities. Every military hospital is stretched thin. Then we make what we have count, Weber said. We use penicillin for the youngest patients and those who present earliest. For others, we use combination therapy, sulfatazine with supportive care, aggressive fever management, fluid replacement, pain control. We fight for every life, even without perfect weapons. Morrison nodded slowly. All right, tell me what else you need. Ice, lots of ice. Cooling reduces intracranial pressure and may slow the infection's progression. I need basins, towels, and a steady supply of ice delivered to the isolation ward every 2 hours. Done. Spinal tap equipment. We need to monitor cerebrospinal fluid in all active cases every 24 hours. The appearance of the fluid tells us if the infection is responding to treatment. We have enough kits for maybe 20 taps. Order more. Order everything. This is not the time for economy. The Army doesn't move that fast. Weber's laugh was bitter. Then the Army will watch men die while it processes requisition forms. I have seen this too, Dr. Morrison. The Wehrmacht was very good at forms, less good at keeping soldiers alive. For the first time, Morrison's expression softened slightly. I'll do what I can. What else? Staff. I cannot do this alone. I need at least 4 nurses who can work around the clock in shifts. I need orderlies who are not afraid of infection, and I need German prisoners who have medical training. There are at least 30 physicians and medical corpsmen in this camp. Use them. That's, Morrison hesitated, that's complicated. Using prisoners to treat American personnel. The bacteria do not read Geneva Conventions, Weber said. If you want to save lives, you use every resource. Pride is a luxury we cannot afford. Morrison was quiet for a long moment. Then he nodded. I'll speak to the camp commander. If he approves, you'll have your staff. Good. One more thing. Weber paused, knowing this request would be the most difficult. I need to live in the isolation ward, 24 hours a day. If I am going to manage this outbreak, I must be present constantly. I must see every change in patient status, every response to treatment, every new case as it develops. You'll be exposed constantly, Morrison said. Even with prophylaxis, your risk of infection is— I know the risk. Weber's voice was steady. I accept it. This is my training, Dr. Morrison. This is what I do. Morrison studied him for a long moment. Why? He asked finally. Why are you doing this? You're a prisoner. You could give minimal effort, do just enough to avoid punishment. Instead, you're volunteering to risk your life for people who were shooting at you 6 weeks ago. I need to understand why. Weber looked around the ward at the suffering men, American and German alike, united only by their shared vulnerability to an invisible killer. How could he explain to this American doctor what he had learned in 3 years of war? How could he put into words the gradual erosion of ideology under the weight of human suffering? How could he describe the moment when the abstractions of nation and duty and cause had collapsed into the simple, undeniable reality of a dying boy calling for his mother in the mud? I am a doctor, Weber said simply. That is all the reason I need. Morrison held his gaze a moment longer, then nodded. All right, let's get to work. By evening, the transformation was underway. Warehouse 7 had been emptied of its crates and supplies. The concrete floor scrubbed with lye solution, rows of iron beds set up with military precision. 50 beds in 10 rows of 5, each bed separated by 6 feet of space, enough to reduce droplet transmission without making patient monitoring impossible. Sheets, blankets, pillows, and medical supplies materialized with the efficiency that only military logistics could achieve when properly motivated. Overhead lights were installed, their harsh white glow turning the warehouse into a sterile cathedral. Weber supervised the move of all active meningitis cases to the new isolation ward, personally examining each patient before transfer to ensure they could survive the journey. 3 could not be moved. Too critical, too close to death. They remained in the main medical facility, sequestered in a corner ward behind cloth partitions that fluttered with every passing nurse like warning flags. By 2200 hours, the isolation ward held 26 patients, 16 Americans, 10 Germans. The youngest was 19, a guard from Tennessee who had been playing cards the previous evening and was now semi-conscious, his fever spiking despite ice baths and aspirin. The oldest was 42, a German supply sergeant who had survived the Russian front only to be felled by bacteria measuring 1,000th of a millimeter across. Weber had not stopped moving since Morrison's initial summons 12 hours earlier. He had examined patients, organized supplies, trained staff on isolation protocols, and personally administered the first doses of penicillin to the 4 youngest American patients. His hands remembered the motions from hundreds of previous injections: alcohol swab on the skin, needle at a 90-degree angle, slow steady pressure on the plunger, withdrawal and immediate pressure with cotton. Each injection was 200,000 units of penicillin suspended in sterile water, a fortune of medicine delivered in seconds. Now, at nearly midnight, he sat in the small office that had been set up at one end of the warehouse, recording observations in a notebook Morrison had provided. The office had a desk, a chair, a filing cabinet, and a cot that Weber suspected he would rarely use. Medical reference books lined one wall, mostly English texts, but Morrison had somehow procured 2 German medical journals from before the war. Their pages yellowed, but their information still valuable. A knock at the door interrupted his writing. "Herein," he called automatically, then corrected himself. "Come in." A German prisoner entered, a man of about Weber's age with thinning blonde hair and wire-rimmed spectacles. Weber recognized him immediately, Dr. Heinrich Wolf, a gynecologist from Frankfurt who had been conscripted as a Wehrmacht medical officer in 1943. They had spoken briefly during processing, a stilted conversation between strangers united only by shared profession and captivity. "Dr. Weber," Wolf said formally, "Captain Morrison sent me. He said you need additional medical staff." Weber gestured to the second chair. "Sit. Tell me your experience with infectious disease." Wolf settled into the chair with the careful movements of a man who had learned to make himself small in dangerous places. "Limited. In civilian practice, I treated the occasional pneumonia, some tuberculosis cases. In the war. He paused, his eyes distant. I ran a field hospital in France. We saw everything. Gangrene, tetanus, typhus. Men died of infections more than bullets. Meningitis. Twice, both times the patients died within 48 hours. We had no effective treatment. We have treatment now, Weber said. Limited, but real. I need someone who can follow protocols exactly, who will not improvise or assume they know better than the science. Can you do that? Wolf met his eyes. I can follow orders, if that's what you're asking. I've had 4 years of practice. There was something in his tone, a bitterness perhaps, or simply exhaustion. Weber understood. They were both prisoners in a country that had every reason to hate them, working to save the lives of former enemies, doing medicine in conditions that bore little resemblance to the comfortable practices they had once imagined for themselves. Good, Weber said. Report here at 0600 hours tomorrow. Bring any medical supplies you have. I'll brief you on treatment protocols then. Wolf stood but hesitated at the door. May I ask you something? Yes. Why are you doing this? Taking charge, I mean. You could keep your head down, do minimal work, survive until this is over. Instead, you're volunteering to be in the center of an epidemic. It makes no sense. Weber set down his pen. It was the second time someone had asked him that question today. Did you take an oath when you became a doctor, Heinrich? Of course, the Hippocratic tradition. Do you remember what it says? I will use treatment to help the sick according to my ability and judgment, but never with a view to injury and wrongdoing. It doesn't say, I will help German sick, or I will help those who share my politics. It says, the sick. Any sick, all sick. That's idealistic, Wolf said quietly. The war taught me that ideals are the first casualty. Then perhaps this is our chance to recover what we lost, Weber replied. Or perhaps I am simply a fool who cannot help being a doctor, even when wisdom would counsel otherwise. Either way, I need your help. Will you give it? Wolf was silent for a long moment. Then he nodded. Yes, I'll be here at 6. After he left, Weber returned to his notebook, but found himself unable to concentrate on clinical observations. Instead, his mind drifted back to Munich, to the university, to a lecture hall where a younger Carl Weber had sat among 200 other medical students, listening to Professor Kohle explain the nature of epidemic disease. Gentlemen, Kohle had said, and it had been all men then, before the war changed everything. You are about to enter a profession that will ask you to make impossible choices. You will have 10 patients in medicine for 5. You will have 1 bed and 3 dying men. You will have orders from generals and screams from soldiers, and you will have to decide which voice to obey. Here is what I tell you. Obey the science, not the politics, not the propaganda, not your own fear or prejudice. The science, because the science doesn't lie, doesn't have an agenda, doesn't care about your career or your ideology. The science only cares about truth. And truth, gentlemen, is the only thing that will let you sleep at night when you're old. Weber wondered what Kohle would think of him now, treating an epidemic in an enemy prison camp, taking orders from American officers, using techniques that German medical journals might never publish because they came from a collaboration with the victors. Would Kohle see it as honor or treason? As medicine or collaboration? It didn't matter. Kohle was probably dead, killed in the Allied bombing of Berlin, or starved in the chaos of Germany's collapse. The university was likely rubble. The world Weber had known, the orderly, rational world of medical science divorced from politics, had been revealed as a fantasy. Medicine and war were inseparable. They always had been. But that didn't mean he had to accept it. That didn't mean he couldn't try to create a small space where the old rules still applied, where a patient was a patient regardless of uniform, where the only enemy was disease. A cry from the ward pulled him from his thoughts. He was on his feet instantly, grabbing his medical bag and moving toward the sound. Halfway down the ward, a nurse was bent over a bed, her voice urgent. Dr. Weber. Seizure. It was Robert Chen, the young guard, who had been one of the first cases. His body was rigid, back arched, muscles locked in tonic contraction. His eyes had rolled back, showing only whites. Foam flecked his lips. The seizure was a sign of increased intracranial pressure. The infection was causing swelling inside his skull, and his brain was being compressed against the bone. Weber reached the bedside in seconds. "Hold his head," he snapped to the nurse, a stocky woman in her 30s named Lieutenant Sarah Brennan. "Don't let him injure himself, but don't try to restrain the seizure. It'll pass." He checked Chen's airway. Clear, though his breathing was labored. Pulse was rapid, thready. The young man's skin was burning to the touch despite the ice packs positioned around his head and torso. "How long?" Weber asked. 30 seconds, Brennan replied, her voice steady despite the fear Weber could see in her eyes. "This is his third seizure in 2 hours. Not good. Multiple seizures suggested the infection was winning despite the penicillin." Weber needed to reduce the intracranial pressure immediately, or Chen would die not from the infection itself, but from his brain swelling until it herniated through the base of his skull. "I need mannitol," Weber said. 25 grams intravenous now." Brennan hesitated. "We don't have mannitol, only saline and glucose solution." Of course they didn't. Mannitol was a specialized osmotic diuretic used to reduce brain swelling, not standard stock in a prison camp medical facility. Weber cursed under his breath in German, his mind racing through alternatives. Hypertonic saline might work, but they would need to mix it carefully and at this hour with limited supplies. "Get me Morrison," Weber ordered. "Wake him if necessary. Tell him I need emergency transfer authorization to a neurosurgical facility. This patient needs a decompressive procedure that I cannot perform here." "There's no neurosurgery within 100 miles, Brennan said quietly. "Fort Bragg has the nearest capability, and they're not accepting transfers due to their own outbreak." The seizure was subsiding. Chen's muscles relaxed incrementally, the terrible rigidity fading to twitching, then stillness. His breathing remained labored. Weber checked his pupils with a pen light. Both were dilated, but they still reacted to light. That was something. It meant Chen's brainstem was still functional, still fighting. "Then we do what we can with what we have," Weber said. He pulled out his stethoscope, listened to Chen's lungs. Rails, crackling sounds indicating fluid accumulation. The infection was affecting not just Chen's brain, but his respiratory system as well. "Increase his oxygen," Weber ordered. "Elevate the head of the bed 30 degrees to help reduce intracranial pressure. Continue ice packs, but check for frostbite every 30 minutes. And start timing his respirations. If they become irregular or stop, we'll need to manually ventilate." Brennan nodded, already moving to adjust the bed. She worked with the practiced efficiency of someone who had seen too much death to be frozen by fear, but retained enough humanity to care desperately about each patient. Weber stayed at Chen's bedside for the next 20 minutes, monitoring every breath, every heartbeat, ready to intervene if another seizure struck. Slowly, Chen's vital signs stabilized, not improving, but not deteriorating further. A plateau. In epidemic medicine, sometimes a plateau was the best you could hope for. When he was certain Chen was stable enough to leave to Brennan's care, Weber returned to his office. But he didn't sit. Couldn't sit. His body was exhausted, but his mind was racing, calculating, projecting. 26 cases now. How many more by morning? How many would die in the next 48 hours, despite everything he could do? He walked back into the ward, moving slowly between the beds, observing each patient. Some slept fitfully, their bodies twitching with fever dreams. Others lay awake, their eyes glassy with pain and confusion. A few called out for water, for morphine, for mothers and wives and God. Weber stopped at each bedside, checking charts, feeling foreheads, offering what comfort words in German or English could provide. At the 8th bed, he found a German private named Otto Schmidt, staring at the ceiling, tears tracking down his temples into his hair. Schmidt was 21, from a village near Dresden. His fever had broken an hour ago, a good sign, but his eyes held a particular quality of despair that Weber recognized. "You are in pain?" Weber asked softly in German, Schmidt's eyes focused on him. "Nein. I mean, yes, but that's not, Herr Doctor. Am I going to die?" Weber pulled up a stool and sat beside the bed. Honesty was the only currency that mattered here. I don't know. The infection is serious. But you're young, strong. You received treatment early. These are advantages. I heard the American in the corner. The seizures. He is very ill, yes. Will that happen to me? It might, or it might not. The disease follows patterns, but each case is individual. I have seen men at death's door recover. I have seen men who seem to be healing die suddenly. The human body is not a machine that I can read like a schematic. Schmidt was quiet for a moment. My mother wrote to me last month. The letter took 3 months to reach me. She said Dresden was bombed. Everything burned. She doesn't know if my sister survived. They were separated in the chaos. I was going to write back, to tell her I was all right, that maybe after the war I could come home and help them rebuild. But now, he didn't finish, didn't need to. Listen to me, Otto, Weber said, his voice low but firm. I cannot promise you will live, but I can promise you this. I will fight for your life with everything I know, every skill, every technique, every drop of medicine we have. You are not a German or a soldier or a prisoner to me. You are a patient, and I do not surrender patients to death without a battle. Schmidt met his eyes. Thank you, Herr Doctor. Weber patted his shoulder and moved on, but Schmidt's words stayed with him. My mother doesn't know if my sister survived. How many mothers, wives, sisters, and children were waiting for news that would never come? How many families would be broken by this invisible killer that cared nothing for political borders or military allegiances? The rest of the night passed in a blur of activity, punctuated by moments of crisis. At 0200 hours, one of the American patients went into respiratory arrest. Weber and Brennan manually ventilated him for 45 minutes using a bag valve mask until his breathing resumed. At 0400, a German corporal developed such severe agitation from delirium that they had to restrain him to prevent him from injuring himself. At 0530, as gray dawn light began to filter through the warehouse's high windows, a young American lieutenant named William Murphy opened his eyes for the first time in 18 hours and asked for water. Weber gave him water, checked his vitals, examined his eyes and neck. Murphy's fever had broken. His neck was still stiff, but markedly improved. The cerebrospinal fluid from his lumbar puncture yesterday had been cloudy with infection. Weber made a note to repeat the tap this morning to see if the penicillin was working. "How do you feel?" Weber asked. Murphy's voice was hoarse. "Like I've been hit by a truck. What happened? Where am I?" "You have bacterial meningitis. You're in the isolation ward at Camp Butner. I'm Dr. Weber. You've been very sick, but you're improving." Murphy's brow furrowed as his fever-addled mind processed this information. "Weber, you're German." "Yes." "A prisoner." "Yes." Murphy was silent for a long moment, his eyes searching Weber's face as if looking for a trap or a trick. "You're treating me, an American." "I am treating patients," Weber replied. "Nationality is irrelevant to bacteria." Another silence. Then Murphy said quietly, "My unit captured a German field hospital last December, in Belgium. The doctors there. They'd executed wounded Americans, just shot them. Said they were too much trouble to keep alive during the retreat." Weber's jaw tightened. He had heard such stories, knew they were true. The SS had committed countless atrocities, and even regular Wehrmacht units had done terrible things in the chaos of defeat. But he also knew that some stories were exaggerated, that fear and propaganda could transform ambiguous situations into certainties of evil. He could not defend the indefensible, but neither would he apologize for crimes he had not committed. "I am not those doctors," Weber said simply. "I am this doctor, the one who has been awake for 24 hours trying to keep you alive. You may judge me by my actions, Lieutenant Murphy. You need not judge me by the actions of men I never met." Murphy studied him a moment longer, then nodded slowly. "Fair enough. Thank you, Doctor. Rest now. I'll check on you again in 2 hours." As he moved away, Weber caught Brennan watching him an unreadable expression on her face. She had heard the exchange, had probably heard hundreds of such conversations in her nursing career, patients confronting the humanity of those they'd been taught to see as monsters. Weber wondered what she thought, this American nurse working shoulder to shoulder with a German prisoner to fight an epidemic that made no distinction between victor and vanquished. At 0600 hours, Dr. Wolf arrived as promised, along with 3 other German medical personnel, 2 former Wehrmacht medics and a dentist named Kaufmann, who had some surgical training. Morrison arrived 15 minutes later, accompanied by 2 additional American nurses and the camp's chief pharmacist, a gruff major named Sullivan, who looked like he hadn't slept either. They gathered in Weber's office for a briefing. Weber had prepared notes throughout the night: patient status, treatment responses, supply needs, protocol modifications. He spoke for 20 minutes, walking them through each case, explaining the rationale behind his treatment decisions, outlining the challenges ahead. "We now have 26 confirmed cases," Weber concluded. 3 are critical and may not survive the day. 8 are improving with treatment. The remainder are stable but could deteriorate rapidly. Based on typical outbreak progression, I estimate we'll have 15 to 20 new cases today, 30 to 40 by tomorrow. Within 1 week, we could have over 100 active infections. Morrison's expression was grim. "Can we handle 100 patients with our current resources?" "No," Weber said bluntly. "We would need triple the medical staff, 5 times the medicine, and a great deal of luck, which is why we must focus on prevention as aggressively as treatment. Major Sullivan, what is our sulfonamide stock?" Sullivan consulted a ledger. 14,000 tablets. If we're treating 26 patients at full therapeutic dose, that's 3,000 tablets per day. We have maybe 4 days of treatment supply. "But," Weber said, "if we use 2/3 of that supply for prophylaxis, giving 3-day courses to high-risk contacts, we can potentially prevent dozens of new cases. Yes, we would have less medicine for treating active infections, but we would have fewer infections to treat. The mathematics favor prevention." Morrison nodded slowly. "All right, give me your prophylaxis protocol." Weber had it ready. Over the next hour, they worked through the details of a massive prophylaxis campaign. Every guard who worked in a barracks where infection had been detected would receive sulfadiazine. Every prisoner who had bunked within 6 feet of an infected person would receive it. All medical staff, food service workers, and administrative personnel who had any contact with either patients or their quarters would receive it. "That's going to be over 2,000 people receiving prophylaxis," Morrison said. "Yes, which is why we need to organize it efficiently. We'll set up a distribution station here at the isolation ward. People come through in groups of 50, receive their medication under direct observation to ensure compliance, get marked on a master list. No one leaves without taking the full dose." "Some men won't want to take it," one of the nurses said. "Superstition, distrust of medicine, whatever." "Then they will be quarantined separately," Weber said. "We cannot afford individuals who choose to be disease vectors. This is not a matter of rights or preferences. This is epidemic control." Morrison looked uncomfortable but nodded. "I'll need to clear this with the camp commander. He's not going to like forcing medication on prisoners." "Then tell him the alternative is a prison camp where 1 in 5 men dies of meningitis over the next month," Weber replied sharply. "Tell him that corpses do not care about administrative niceties. Tell him—" He stopped, realizing his tone had become harsh, took a breath. "Forgive me. I am tired. But Dr. Morrison, we are at a critical juncture. The decisions made today will determine whether we contain this outbreak or watch it consume this facility. I have seen epidemics. I have seen men die by the thousands because bureaucracy moves slower than bacteria. Do not let that happen here." Morrison met his eyes. "I'll get you authorization. What else?" They spent the next 2 hours organizing the response. Wolf and the other German medical staff were assigned sectors of the camp to monitor for new cases. Brennan and the American nurses developed a rotation schedule that would keep medical personnel in the isolation ward 24 hours a day without exhausting anyone. Sullivan worked on procurement, identifying every possible source of additional medicine. Morrison handled the administrative battles with the Camp Command and the Army Medical Corps. By 0900 hours, the prophylaxis distribution station was operational. The first group of 50 guards filed through, each man receiving 4 sulfadiazine tablets and a cup of water, swallowing under the watchful eyes of Lieutenant Brennan, who checked off names on a master roster. Some men grumbled. A few looked frightened, but they took the medicine. Weber watched from the doorway of his office, feeling a small surge of satisfaction. This was how you fought an epidemic, not with heroic individual medicine, but with systematic public health measures implemented with military precision. For every case he treated, prophylaxis might prevent 5. For every life he saved at a bedside, this distribution campaign might save 20. But even as the prophylaxis program rolled forward, new cases arrived. 3 more that morning, 2 German prisoners, 1 American guard. Weber examined each one personally, took their medical histories, explained the treatment they would receive. By noon, the isolation ward held 29 patients. And Robert Chen, the young guard who had seized repeatedly during the night, died at 1300 hours. His brain had swollen despite all efforts to control the pressure. His heart simply stopped, his breathing ceased, and no amount of manual resuscitation could bring him back. Weber pronounced him dead at 1304, covered his face with a sheet, and moved on to the next patient. There was no time for grief. There were 28 others who still needed him. That evening, Morrison found Weber in the ward, checking on William Murphy's progress. Murphy was sitting up now, managing to eat a small amount of broth. His improvement was remarkable, a testament to early penicillin treatment. "We lost Chen," Morrison said quietly. "I know. I was there." He was 23, married, wife's pregnant with their first child. Weber said nothing. What could he say? That death was a part of medicine, that you couldn't save them all, that Chen's death might save others by teaching them what didn't work. All true, all utterly inadequate. His wife will receive a letter saying he died of illness while serving his country, Morrison continued. They won't tell her it was meningitis. Won't tell her he died in a prison camp, treated by a German doctor. They'll make it sound noble somehow. "Is that not what it was?" Weber asked quietly. "He was guarding prisoners, doing his duty. He fell ill. He received the best care we could provide. He died anyway. Where is the shame in that?" "There's no shame. Morrison trailed off, struggling for words. "I keep wondering if we'd caught it earlier, if we'd had more medicine, if I'd called you in sooner." "You will drive yourself mad with such thoughts," Weber said. "I know. I have done this many times. The truth is that Chen's infection was already advanced when symptoms appeared. The bacteria had seeded his bloodstream, his brain. Even with perfect treatment from the first moment, his chances were perhaps 50%. You made every reasonable decision. Sometimes that is still not enough." Morrison was quiet for a long moment. "How do you bear it? The deaths?" Weber considered the question. How did he bear it? He had watched men die for 3 years, had held their hands as they bled out or suffocated or burned with fever. He had pronounced dead young men who reminded him of students he'd taught, of brothers and cousins and friends. He had written so many death certificates that his handwriting had become mechanical, the words losing meaning through repetition. "I bear it because the alternative is to give up," Weber said finally. "And if I give up, more die. So I continue. I do my work. I save who I can. And I remember that every death I witness is one that someone, some mother, some wife, some child, will grieve. My witnessing honors that. My grief, small as it is compared to theirs, acknowledges that this person mattered. That is all I can offer." Morrison nodded slowly. "Thank you for everything you're doing here. Thank you for trusting me to do it." After Morrison left, Weber returned to his rounds. It was nearly 2200 hours. He had been awake for 40 hours. His body ached, his eyes burned, his hands trembled with exhaustion. But there were still patients to check, charts to update, medications to administer. At the bed of Otto Schmidt, The young private who had worried about his mother and sister, Weber found reason for hope. Schmidt's fever had broken. His mental status had cleared. His neck was still stiff, but improving. The infection was retreating before the sulfadiazine assault. "You're going to live, Otto," Weber said, unable to keep the satisfaction from his voice. Schmidt's eyes filled with tears. "Really? Really? You'll need several more days of treatment, and you may have some lingering effects, headaches, perhaps some weakness. But you will recover. You will write to your mother. You will go home." Schmidt grabbed Weber's hand with surprising strength. "Thank you, Herr Doctor. Thank you." Weber squeezed back, then gently extracted his hand. "Thank the penicillin. Thank your youth and strength. Thank whatever luck or providence brought you here before the infection progressed too far. I am merely the instrument." But as he moved to the next bed, Weber allowed himself a moment of quiet satisfaction. One death, but also one life saved that might have been lost. In war, in epidemic, in the desperate mathematics of limited resources, that was victory. He would take it. Day 5, 41 active cases, 3 more dead. The isolation ward had been expanded into an adjacent warehouse, creating space for 80 beds total. They were 3/4 full. Weber had not left the medical compound in 96 hours. He had slept perhaps 12 hours total in that time, collapsing onto the cot in his office for brief intervals before some new crisis pulled him awake. He had lost weight. His uniform hung loose, his belt notched tighter. His eyes were sunken. His hands developed a fine tremor that appeared whenever he held still. But the outbreak was stabilizing. The aggressive prophylaxis campaign had worked. Instead of the exponential growth Weber had feared, new cases were appearing at a steady but manageable rate of 5 to 7 per day. More importantly, the mortality rate was holding at 15%, catastrophic by peacetime standards, but remarkable for a disease that typically killed 60 to 70% of its victims. The word had spread through the camp. The German doctor was performing miracles. Prisoners and guards alike spoke of Weber with a mixture of awe and incomprehension. How could an enemy care so much? How could someone work so tirelessly for people who had bombed his country, killed his countrymen, conquered his homeland? Weber ignored the talk. He had no energy for philosophy or propaganda. He had only enough energy for the next patient, the next crisis, the next impossible decision about who received the dwindling supply of penicillin. On the morning of day 5, Morrison found him in the supply room, counting vials of medicine by the light of a single bulb. The room smelled of alcohol and antiseptic, familiar smells that had become Weber's constant atmosphere. "Carl," Morrison said, they were on first-name terms now, the formality of military hierarchy dissolved by shared exhaustion. "You need to rest. You're going to collapse. After this count, we need to know exactly what we have." "I've already done the count. 3,000 units of penicillin remaining. Enough for 1 more patient at your protocol, maybe 2 at reduced doses. 6,000 sulfadiazine tablets. 2 weeks of oxygen. 4 days of 3,000 units. Weber's voice was sharp. "But yesterday we had 15,000. Morrison's expression was carefully neutral. "We used 12,000 yesterday. The 4 new critical cases. You authorized it." Weber closed his eyes, trying to remember. Yesterday was a blur. There had been an American sergeant, a German lieutenant, 2 prisoners whose names he couldn't recall. All of them with rapidly progressive infections, all of them needing the high-dose penicillin protocol that Weber knew was their only chance. He had ordered the treatment without hesitation. Now there was almost nothing left. "When is the next shipment arriving?" Weber asked. "Unknown. Sullivan has been calling Richmond, Fort Bragg, Walter Reed. Everyone's in the same situation. There was a manufacturing problem at one of the main production facilities. Supplies are being rationed for combat zones first, then stateside military hospitals, then everything else. We're everything else." Weber sat down heavily on a crate of bandages. 3,000 units. 1 patient. After that, they would be back to sulfadiazine and prayer. the medicine of last resort that worked sometimes but not often enough. How do I choose? Weber said quietly. When the next critical case comes, and it will come, James, you know it will, how do I decide who gets the penicillin, the youngest, the one with the best prognosis, the American over the German, the guard over the prisoner? Morrison sat beside him. I don't know. I've been thinking about that question for 5 days, and I don't have an answer. In Russia, Weber said, his voice distant, we made these choices constantly. Not enough morphine, so you decided who got pain relief and who had to endure. Not enough anesthetic, so you decided who got surgery awake and screaming. Not enough ambulances, so you decided who got evacuated and who was left to die in the mud. I thought I had learned to make such decisions. I thought I had become hardened to it. But I was wrong. Every choice still feels like playing God, and I am not qualified for that role. They sat in silence for a moment, two doctors contemplating the impossible mathematics of triage. There's something else, Morrison said finally. The camp commander wants to see you. Today at 1400 hours. Weber looked up sharply. Why? I don't know, but he specifically requested you, not me, not the medical staff, you. A summons from the camp commander was never good news. Colonel Harrison Blake was a career military man who had made it clear he disapproved of using prisoners for anything beyond manual labor. He had only grudgingly approved Weber's expanded role in the epidemic response, and only because Morrison had made it clear that without Weber, the death toll would be catastrophic. I will go, Weber said, but I need to check the morning patients first. Carl, you can't keep... I need to check the patients first, Weber repeated firmly. That is not negotiable. Morrison sighed but nodded. All right, but after you meet with Blake, you're going to sleep, even if I have to sedate you myself. The morning rounds revealed good news and bad. Good. William Murphy and 3 other early patients were well enough to be discharged from isolation. Their cerebrospinal fluid had cleared, their symptoms had resolved, and they no longer posed a transmission risk. Murphy shook Weber's hand before leaving, his grip firm, his eyes clear. I'm going to tell people about this, Murphy said, about what you did here, about how you didn't see enemies, just patients. Weber was too tired to respond with more than a nod, but something in Murphy's words touched him. Perhaps it was the idea that this moment, this small triumph of medicine over politics, might be remembered, that someone might look back and see not a German and an American, but 2 human beings who had chosen compassion over hatred. Bad news. A new case had arrived during the night. A German prisoner named Karl Rothman, age 19, with rapidly progressive symptoms. By morning, he was barely conscious, his fever spiking above 105 degrees, despite aggressive cooling. His lumbar puncture showed the worst cerebrospinal fluid Weber had seen, thick, purulent, loaded with bacteria. Without high-dose penicillin, Rothman would almost certainly die. Weber stood at Rothman's bedside, staring at the young man's face. He looked even younger than 19, his features soft, unformed. Weber found himself wondering about Rothman's story. How had he ended up here, conscripted like so many others? Had he believed in the cause, or had he simply done what he was told because refusal meant execution? Did his mother know where he was? Would anyone mourn him if he died on this cot, in this converted warehouse, thousands of miles from home? Dr. Weber. It was Wolf, approaching with a chart. Rothman's blood cultures are back, positive for meningococcus with heavy growth, and his platelet count is dropping, down to 40,000. He's going into DIC. Disseminated intravascular coagulation. The infection had triggered a cascade of clotting throughout Rothman's bloodstream, consuming his platelets and clotting factors. He would bleed internally, hemorrhage into his brain. His organs would fail. It was a death sentence. Unless... Weber looked at the supply cabinet where the last 3,000 units of penicillin waited in glass vials. Enough for one patient, one chance to save a life. But what if another critical case arrived tomorrow? someone with a better prognosis, someone American whose death might have political consequences that would affect the entire medical program. What if by using the penicillin now, he doomed someone else later? Prepare the penicillin, Weber said quietly. 2 million units over 24 hours. Start immediately. Wolf hesitated. Carl, are you certain this is the last of our supply? I am certain of nothing except that this young man is dying now, today, and I have medicine that might save him. Tomorrow's hypothetical patient can wait for tomorrow's decision. Prepare the medicine. Wolf nodded and moved to comply. Weber remained at Rothman's bedside, watching the shallow rise and fall of the boy's chest. He had made his choice. He could only pray it was the right one. At 1400 hours precisely, Weber presented himself at Colonel Blake's office in the camp's administration building. It was the first time he had left the medical compound in nearly a week. The walk across the grounds felt strange, almost dreamlike. The world had continued while he had been sealed in the isolation ward. Prisoners still did their work details. Guards still manned their towers. The camp's routine had ground forward regardless of the invisible war being fought in the warehouses. Blake's office was austere. A desk, filing cabinets, an American flag in one corner, a portrait of President Roosevelt on the wall. Blake himself was in his late 50s, gray-haired, with the rigid posture of a man who had made discipline his religion. He did not invite Weber to sit. Dr. Weber, Blake said, his tone clipped. I'll be direct. I've received a report from the Army Medical Corps regarding your treatment of this epidemic. They're impressed. Mortality rates well below typical outbreak statistics. Infection contained before it could spread beyond the camp. No breach of quarantine protocols. It's been, he seemed to struggle with the word, exemplary. Weber waited. There was clearly more. However, Blake continued, there have been some concerns raised. You've been granted extraordinary authority for a prisoner of war. You've had access to restricted areas, to American medical personnel, to sensitive information about camp operations. Some in the chain of command are uncomfortable with this. I understand their concerns, Weber said carefully, but I would note that every decision I have made has been supervised by Dr. Morrison. I have taken no actions without American oversight. That's not entirely true, is it? Blake's eyes were hard. Morrison tells me you've been working 18-hour shifts, often alone in the isolation ward. You've had unsupervised access to patients, to medical records, to supply inventories. For all we know, you could be gathering intelligence, planning some kind of action. Weber felt anger kindle in his chest, hot and sharp. He had not slept properly in 5 days. He had watched men die. He had made impossible choices. He had poured everything he had, every skill, every ounce of strength, into saving lives. And now he was being accused of espionage. With respect, Colonel, Weber said, his voice tight, if I were gathering intelligence, I am doing an exceptionally poor job of it. I know nothing about your camp operations beyond the medical facility. I have no interest in your guard rotations, your communication systems, your supply chains. I know how many vials of penicillin remain in storage and exactly how many men have bacterial meningitis. That is the sum total of my knowledge and the limit of my concern. Blake studied him for a long moment. Why are you doing this, Weber? Really? I've read your file. You're a skilled physician. You could have stayed safe, done minimal work, waited out the war. Instead, you volunteered to be in the middle of an epidemic, risking your own life, working yourself to exhaustion. For what? To impress us, to earn favorable treatment. Weber took a breath, trying to control his temper. He was so tired, too tired for this. But Blake deserved an honest answer. I am doing this because it is my job, Weber said. Not my job as a German soldier. That ended when I surrendered. Not my job as a prisoner. That is simply to survive. My job as a doctor. That is the one identity I cannot shed, cannot ignore, cannot set aside for convenience. When I see a sick person, I treat them. When I see an epidemic, I fight it. When I am asked to help, I help. Not because I expect reward or favorable treatment, Not because I am trying to prove anything about Germans or Americans or the war, but because I took an oath, Colonel Blake. An oath that does not specify nationality or political system. An oath that says simply, I will help the sick. That is why I am doing this. Blake's expression remained unreadable. And when the war ends, when Germany surrenders, and it will, Dr. Weber, probably within months, what then? You think we'll forget you're the enemy. You think this medical work will erase what your country has done. No, Weber said quietly. I do not think that. I do not expect gratitude or forgiveness. I do not expect to be remembered at all. When this is over, I will return to Germany, if Germany still exists. I will try to rebuild, to practice medicine in peacetime, if such a thing is still possible. But what happens to me personally is irrelevant. What matters is that here, now, in this moment, I can do something good. I can save lives that would otherwise be lost. That is enough. That has to be enough. Blake was silent for a long moment, his fingers drumming on his desk. Finally, he nodded. All right, you can continue your work. But understand this. You're still a prisoner. You're still technically an enemy combatant. If I see any evidence, any at all, that you're abusing your position, this arrangement ends immediately. Clear. Clear. Dismissed. Weber saluted, a reflex from his Wehrmacht service, then turned and left the office. His hands were shaking, though whether from anger, exhaustion, or relief, he couldn't say. Outside, Morrison was waiting, leaning against a jeep. How did it go? I'm still permitted to work, for now. Good, because we have a problem. Of course they did. There was always a problem. Rothman is responding to the penicillin, Morrison said. Fever's down, mental status improving. You made the right call. That's not a problem. That's a success. The problem is that we have 2 more critical cases, both American. Both need high-dose penicillin, and we have none left. Weber closed his eyes. This was the nightmare scenario he had been dreading. Critical patients who needed medicine that didn't exist. Lives he could save, if only he had the tools. What are their names? He asked. Sergeant Thomas Crawford, age 31. Married, 2 kids. Presented with symptoms 12 hours ago. Already progressing to altered mental status. And Private David Walsh, age 22. Single. His infection is earlier, better prognosis, but still needs treatment. What about sulfadiazine? Already started, but you know as well as I do that it's not as effective for rapidly progressive cases. Weber did know sulfadiazine could work, but it was slower, less reliable. With penicillin, Crawford and Walsh had an 80% chance of survival. With only sulfadiazine, their odds dropped to 40, maybe 50%. And there was nothing he could do about it. I want to see them, Weber said. They returned to the isolation ward together. Crawford and Walsh lay in adjacent beds, both feverish, both deteriorating, despite the sulfadiazine infusions. Weber examined each man carefully, taking his time despite the urgency. Crawford's pupils were sluggish, a bad sign. Walsh's neck was rigid as wood. Both were young, strong, with every reason to live. Both would probably die without better medicine. Weber stood between their beds, staring at the ceiling, his mind racing through possibilities. Could they reduce the penicillin dose? No, he had tried that in Russia, and patients had relapsed. Could they use alternative antibiotics? None existed that would work fast enough. Could they call in favors, beg other facilities for emergency supplies? Morrison had already tried everything. There was no solution. Sometimes medicine didn't offer solutions, only choices between bad options. We continue sulfadiazine, Weber said finally. Maximum doses, aggressive supportive care, ice baths, oxygen, fluid management. We give them every advantage we can. And we hope. Hope, Morrison repeated. The word sounded like a curse. Hope, Weber confirmed. It is all we have left. That evening, as Weber tried and failed to sleep on the cot in his office, he found himself thinking about the moment that had brought him to this place. Bastogne, the Ardennes. the battle the Americans called the Bulge. He had been assigned to a field hospital set up in a destroyed farmhouse, treating German casualties from the offensive that was Hitler's last desperate gamble to split the Allied armies. They had been overwhelmed from the first day. Casualties flooded in faster than they could be triaged, men with shrapnel wounds, compound fractures, amputations, frostbite. Weber had operated for 72 hours straight, doing battlefield surgery by candlelight while artillery shook the walls. He had saved some, lost more, became numb to the screams. On the fourth day, American prisoners had been brought in, wounded men captured during the German advance. The SS officer commanding the hospital detail had ordered Weber to leave them untreated. "They are not our concern," the officer had said. "Focus on German soldiers. Let the Americans die." Weber had looked at those wounded Americans, boys really 19 and 20 years old, bleeding and terrified, and he had made a choice. He had put down his scalpel, removed his surgical gloves, and walked to where the SS officer stood. "I will not abandon wounded men," Weber had said. The officer's hand had moved to his sidearm. "You are refusing a direct order." "I am following a higher order, the Hippocratic Oath. I am a physician before I am a soldier. I will treat these men." For a moment, Weber had been certain he was about to be shot. The SS officer's face had gone white with rage, but before he could draw his weapon, the building shook with a massive explosion. American artillery getting closer. In the chaos that followed, the officer had disappeared, running to join his unit. And Weber had stayed, treating German and American wounded side by side until the Americans overran the position the next day. Those wounded Americans had become his advocates. They had testified that he had saved their lives, that he had defied orders to help them. That testimony had likely saved his own life. Now he was here in an American prison camp fighting a different kind of war. And once again he was making choices that defied simple logic, using the last penicillin on a German private when he might have saved it for an American. Exhausting himself for people who might never appreciate what he had done. Risking everything for an ideal that the real world seemed determined to prove naive. But what was the alternative? To become the SS officer who had ordered him to let men die, to let politics and nationality determine who deserved medical care, to abandon the principles that had defined him as a doctor because they were inconvenient or dangerous. No. He would rather die believing in something impossible than live having compromised everything that mattered. Sleep, when it finally came, was fitful and brief. Day 12. 51 active cases, 8 dead. But the curve had finally bent downward. New cases arrived at a rate of only 2 to 3 per day, and most were mild, caught early enough that sulfadiazine treatment was effective. The prophylaxis campaign had worked. The isolation protocols had worked. The mathematics of epidemic control applied with military precision had worked. Sergeant Thomas Crawford had died on day 8. Private David Walsh had survived, defying Weber's pessimistic odds. Carl Rothman, the 19-year-old who had received the last of the penicillin, was sitting up in bed, eating solid food, asking when he could return to his barracks. Weber had told him another 3 days of observation, knowing that Rothman would spend the rest of his life never knowing that his survival had cost Crawford his chance. That was the nature of triage. Someone always paid the price for someone else's life. The only question was who made the choice and whether they could live with it afterward. On the morning of day 12, a truck arrived from Richmond with emergency medical supplies. 10,000 sulfadiazine tablets, 50,000 units of penicillin, oxygen tanks, IV fluids, surgical supplies. It was too late for Crawford and the 7 others who had died, but it meant everyone else would have a chance. Weber stood in the supply room staring at the wooden crates marked with red crosses, feeling something break inside him. For 12 days he had operated on the edge of disaster, making impossible calculations about who would live and who would die. For 12 days he had rationed medicine like a miser counting gold, knowing that every dose he gave to one patient was a dose denied to another. For 12 days, he had carried the weight of those decisions like stones in his chest. Now there was enough. Now he could treat every patient without wondering if he was condemning someone else. Now the impossible choices could stop. He sat down on one of the crates and put his face in his hands. His shoulders shook. No tears came. He was too exhausted for tears, but something in him was breaking, releasing, letting go. The strain of 12 days compressed into a single moment of recognition. They had won. The epidemic was contained. Most would survive. He had done what he came here to do. "Carl," Morrison's voice, gentle, a hand on his shoulder. "You all right?" Weber looked up. Morrison stood in the doorway, his expression concerned. Behind him, Lieutenant Brennan hovered, her face showing the same mixture of worry and exhaustion that Weber saw in mirrors. "I'm fine," Weber said, his voice hoarse. "Just tired." "You're more than tired. You're operating on fumes." Morrison pulled up a crate and sat beside him. "The crisis is over, Carl. We have supplies now. The infection rate is dropping. You can rest." "Can I?" Weber heard the bitterness in his own voice. 8 men died, James. 8. 3 of them might have lived if I had made different choices. If I had rationed the penicillin differently. If I had triaged more aggressively. If I had— "Stop," Morrison said firmly. "I've been a doctor for 23 years, and I can tell you with absolute certainty, you cannot save everyone. You did everything right. Your protocols, your treatment decisions, your epidemic control measures, they were textbook perfect, better than textbook. We kept the mortality rate under 15% when typical outbreaks see 60, 70%. That's not failure, Carl. That's a goddamn miracle." "It doesn't feel like a miracle to Crawford's wife, or to the others who died." "No," Morrison agreed quietly. "It doesn't. But you know what would feel worse. If we'd lost 40 men instead of 8, if this epidemic had swept through the entire camp, killing hundreds, because we didn't have someone who knew what they were doing. You saved lives, Carl. Dozens, maybe hundreds of lives. Don't let the ones you couldn't save make you forget the ones you did." Weber was quiet for a long moment. Intellectually, he knew Morrison was right. The numbers supported it. But numbers were abstractions. The dead were real. He could see their faces when he closed his eyes. Chen, Crawford, the others. Young men who had died under his care, whose last breaths he had heard, whose death certificates he had signed. "How do you bear it?" Weber asked. "The weight of the decisions, the knowledge that your choices determine who lives and who dies." Morrison was silent for a moment, his eyes distant. "You want the truth. I don't think we're meant to bear it comfortably. I think the weight is supposed to be there, reminding us that these are lives, not numbers. The day I stop feeling the weight is the day I should stop practicing medicine." He paused. "But here's what I've learned. You can carry the weight without letting it crush you. You honor the dead by fighting harder for the living. You acknowledge your limits while still doing everything in your power. And you remember that being a doctor doesn't make you God. You're just a human being with skills and knowledge, doing your best in impossible situations." Weber nodded slowly. It wasn't comfort exactly, but it was recognition. Someone else who understood the peculiar burden of medical responsibility. "Thank you," Weber said quietly. "For what?" "For trusting me, for giving me the authority to do this work, for treating me as a colleague instead of an enemy." Morrison smiled slightly. "You know what's funny? I spent the first 5 days of this epidemic terrified that you were going to do something to prove my trust was misplaced. Sabotage treatment, harm patients, gather intelligence. I barely slept. I was so worried. Then I realized you were working harder than anyone. You were spending 18 hours a day trying to save American lives. You were making decisions that put my men ahead of your countrymen." He shook his head. "I'm ashamed of my suspicion and grateful for your dedication." I did nothing special, Weber said. I simply did my job. That's where you're wrong, Morrison replied. Most people in your position would have done the minimum, followed orders, stayed safe, waited for the war to end. You did more than your job. You did something extraordinary. And whether you want to admit it or not, that matters. Before Weber could respond, Brennan appeared in the doorway. Doctors, you're needed. Rothman is asking for you both. They found Rothman sitting on the edge of his bed, looking stronger than he had in days. Color had returned to his face. His eyes were clear. The transformation from the delirious, fever-ravaged young man Weber had seen 12 days ago was striking. Herr Dr. Weber, Rothman said in German. Dr. Morrison, I wanted to thank you. The nurses told me. They said I almost died, that you used the last medicine to save me. Weber exchanged a glance with Morrison. They had not discussed their supply situation with patients, had not wanted them to know the desperate calculations being made around their beds. You received the treatment you needed, Weber said carefully. That is all that matters. But I heard the nurses talking. They said there were 2 Americans who came in after me, critical cases. They said those men needed penicillin too, but there was none left. Rothman's voice cracked. They said one of them died because you used the medicine on me. A German, a prisoner. The silence that followed was profound. Weber could see the guilt and confusion warring in Rothman's young face, the burden of survival when someone else had died. Listen to me, Carl, Weber said, using the young man's first name deliberately. Medical decisions are not about nationality. They are about timing, about severity, about who needs treatment most urgently. You received penicillin because your infection was fulminant, because you presented when medicine was available, because your condition demanded immediate intervention. That is all. The American sergeant who died received the best treatment we could provide. His death was not your fault. It was not anyone's fault. It was simply the mathematics of limited resources in an epidemic. But no, Weber said firmly, you will not carry this burden. I made the medical decisions. I allocated the resources. If there is guilt to be borne, it is mine, not yours. Your only responsibility is to recover, to return to your barracks, to write to your mother in Dresden and tell her you survived. That is how you honor the medicine that saved you, by living well. Rothman's eyes filled with tears. I don't understand you, Herr Doctor. Why would you treat me the same as Americans? We are prisoners. We are the enemy. No, Weber said quietly. You are patients. That is all that matters in my hospital. German, American, British, Russian. These are labels that disappear at the bedside. All I see are human beings who need help. All I am required to do is provide it. He paused, looking at this young man who might have been his student in another life, in a world without war. Do you know what I learned in this war, Carl? I learned that everyone suffers the same. Everyone bleeds the same color. Everyone calls for their mother when they're dying. The uniform doesn't change that. The flag doesn't change that. At the end, we are all just human beings, fragile and temporary, trying to survive in a world that seems determined to destroy us. If I can reduce that suffering, even a little, even for a few people, then I have done something worthwhile. That is all medicine is. That is all medicine should be. Morrison cleared his throat. Well said. He turned to Rothman, switching to halting German. You're healing well. Another few days and you can return to regular quarters. But you'll need to take it easy for a while. No heavy work. And if you experience headaches, dizziness, or any unusual symptoms, you report to medical immediately. Understood. Jawohl, Rothman said, snapping to attention as much as his weakened condition allowed. After they left Rothman's bedside, Morrison pulled Weber aside. That was good what you said to him, about not carrying the burden. But I notice you didn't apply that advice to yourself. Weber smiled faintly. Do as I say, not as I do. Something like that. Morrison's expression grew serious. Carl, I need to talk to you about what happens next, after this epidemic is fully resolved. I return to being a regular prisoner, I assume. Back to my barracks? Back to work details? Actually, no. I've put in a formal request to have you assigned permanently to the medical facility. We need experienced doctors, and you've proven your value. If it's approved, and I think it will be, you'll continue working with the medical staff, treating both prisoners and American personnel. It would mean better quarters, better food, more freedom of movement within the medical compound. Weber was quiet for a moment, processing this information. Permanent medical assignment would be a significant improvement in his circumstances. It would mean continuing to do real medicine, to use his skills, to be something more than just another prisoner waiting out the war. But it would also mean something else: collaboration, officially working for the American military. Some in Germany would call it treason. After the war, if there was an after the war, would he be punished for helping the enemy? Would his medical colleagues view him as a traitor who had sided with the conquerors? "I can see you thinking about the politics," Morrison said. "Let me make it simple. This war is ending. Germany is losing. Within months, maybe weeks, it will be over. What you do now in these final days will define who you are when peace comes. You can be the German doctor who sat in a prison camp doing nothing, waiting passively for it all to end. Or you can be the doctor who fought to save lives, who transcended politics and nationality, who reminded people that medicine is about humanity, not ideology. Which legacy do you want?" Weber met his eyes. "I want to keep practicing medicine. That is all I have ever wanted." "Then accept the assignment. Help me rebuild the medical program here. Teach our corpsmen, share your knowledge. And when this war ends, when you go home, and you will go home, Carl, I'll make sure of it, you'll know you did something good, something that mattered." "All right," Weber said. "I accept." Morrison smiled and extended his hand. They shook, and Weber felt the gesture's weight. This was more than just an administrative reassignment. It was a partnership, a recognition of mutual respect, a small act of defiance against the tribalism that had consumed the world. Over the following weeks, the epidemic gradually faded. New cases dwindled to 1 or 2 per week, then none. The isolation ward emptied as patients recovered and returned to their quarters. By day 30, the crisis was officially over. 56 total cases, 10 dead, 46 survived, an 82% survival rate that would later be studied in medical journals as one of the most successful meningitis outbreak responses of the war. Weber settled into his new role as the medical facility's senior physician for infectious diseases. He treated the usual camp ailments, respiratory infections, gastrointestinal illnesses, the occasional broken bone from work detail accidents. He trained American medical corpsmen in advanced bacteriology and epidemic control. He established protocols for sanitation, nutrition, and preventive care that reduced overall morbidity throughout the camp. But more than that, he became something unexpected, a bridge, a symbol of what cooperation could achieve when people chose medicine over ideology. Prisoners who were sick asked specifically for Dr. Weber. American guards who had initially viewed him with suspicion now greeted him with respect. The medical compound became a kind of neutral zone where the usual rules of captivity seemed suspended, where German and American medical personnel worked side by side, united by their common profession. Winter turned to spring. The snow melted. The red clay of North Carolina turned muddy, then dried to dust. News from Europe grew increasingly grim for Germany. The Rhine crossed, Berlin surrounded, Hitler dead in his bunker. On May 8, 1945, the war in Europe ended. Germany surrendered unconditionally. Weber heard the news in the medical facility's break room, where someone had left a radio playing. The announcer's voice was jubilant, triumphant, speaking of victory and liberation and the end of tyranny. Around him, American personnel celebrated, shaking hands, embracing, some crying with relief. Weber stood apart, feeling nothing. No joy, no despair, just a vast emptiness. Germany was defeated. The country he had grown up in, studied in, practiced medicine in, no longer existed in any meaningful way. What would be left? Rubble and ruins and millions of displaced, traumatized people. How would they rebuild? How would medicine function in a destroyed nation? Morrison found him standing alone by the window, staring out at the camp. "Carl, you all right?" "I'm fine, just thinking about what comes next." "What comes next is you go home," Morrison said. "Prisoner repatriation will take months to organize, but eventually you'll be shipped back to Germany." "To do what?" "Everything is destroyed. The hospitals, the universities, the infrastructure. How do I practice medicine in rubble?" "The same way you practiced medicine in a converted tobacco warehouse with inadequate supplies," Morrison replied. "You do the best you can with what you have. You build from scratch if necessary. You remember that people will need doctors more than ever. And you use what you learned here about epidemic control, about working with limited resources, about staying human in inhuman conditions." Weber nodded slowly. "And after I go home, after this, will anyone remember what happened here?" Morrison was quiet for a moment. "I'll remember. The nurses will remember. The men you saved will remember. That's not nothing, Carl. It's not monuments or history books, but it's real." And maybe that's enough. The repatriation came in October 1945, 6 months after the war's end, 6 months spent in limbo as the military bureaucracy processed thousands of prisoners, determined their fates, arranged transportation back to a Germany that barely existed. On his last day at Camp Butner, Weber made one final round of the medical facility. It looked different now, organized, well-supplied, staffed with trained personnel who had internalized the protocols he had helped establish. The isolation ward was empty, its beds stripped, waiting for the next crisis. The main ward held only a handful of patients, minor injuries, routine illnesses, nothing dramatic. Lieutenant Brennan found him in his old office, packing the few personal items he had accumulated. She carried a folder. "Dr. Weber, I wanted to give you something before you left." She handed him the folder. Inside were letters, dozens of them. Letters from William Murphy, the first patient Weber had treated, who was now a police officer in Boston. Letters from Otto Schmidt, who had returned to Dresden and was helping clear rubble and search for survivors. Letters from the families of men who had survived the epidemic, thanking him for saving their sons, brothers, husbands. There were also official commendations from the Army Medical Corps, praising his work during the outbreak. A letter from the camp commander acknowledging his service. Even a note from Colonel Blake, the man who had once suspected him of espionage, stating simply, "You proved me wrong, Dr. Weber. Thank you for your service to humanity." Weber's hands trembled as he read them. He had not expected this, had not thought that anyone beyond Morrison and the immediate medical staff would acknowledge what had happened. "You made a difference here," Brennan said quietly. "You saved lives. But more than that, you showed people that enemies can become healers, that nationality doesn't determine character, that there's something higher than politics. Call it duty, call it compassion, call it whatever you want. You showed us that it's real." Weber looked up at her, this competent, dedicated nurse who had worked beside him through the worst of the epidemic. "Thank you, Sarah, for everything," she smiled. "Take care of yourself, Doctor. Germany needs people like you." The journey home was surreal. A Liberty ship from Norfolk to Bremen, crowded with repatriated prisoners, ex-soldiers, and displaced persons. 3 weeks crossing the Atlantic in late autumn, the ship rolling through heavy seas, men crammed into holds that smelled of vomit and unwashed bodies. Weber spent much of the voyage treating seasickness, minor injuries, and the psychological wounds that would take years to heal. When they finally docked in Bremen, Weber stood on deck, looking at a city he barely recognized. Where grand buildings had stood, there were hollow shells. Where parks had bloomed, there were bomb craters. The harbor was choked with sunken ships, their masts protruding from the water like tombstones, everywhere rubble, mountains of it. A civilization reduced to broken concrete and twisted metal. He made his way to Munich, traveling by train through a landscape of devastation, villages destroyed, bridges collapsed, fields still cratered from artillery. At night, sleeping in crowded train stations, he heard men crying out in nightmares, heard women weeping for lost children, heard the hollow laughter of people who had survived but could not comprehend what they had lost. Munich was worse than Bremen. The old city he had known, the university district, the hospitals, the cafes where medical students had debated philosophy, was gone. The twin towers of the Frauenkirche still stood, but surrounded by ruins. The university had been bombed. The Institute for Infectious Diseases, where he had studied under Professor Kohle, was rubble. Weber found temporary housing in the basement of a partially destroyed apartment building, sharing space with 2 other families. Food was scarce, electricity sporadic. Water had to be hauled from public pumps. Disease was rampant: tuberculosis, typhoid, dysentery, malnutrition. People died in the streets, and there were not enough resources to properly bury them. But there were also people trying to rebuild. Doctors setting up makeshift clinics in basements and ruined buildings. Nurses organizing vaccination campaigns. Public health workers trying to prevent epidemics in conditions that made Camp Butner look luxurious. Weber found them through word of mouth and rumor. A clinic operating out of a former school basement. The lead physician was a woman in her 50s named Dr. Margarete Schultz, who had survived the firebombing of Dresden and made her way to Munich seeking a place to practice medicine. "We have no supplies," she told Weber bluntly when he appeared at the clinic's door. "No penicillin, no sulfa drugs, barely any bandages. We're treating pneumonia with mustard poultices, setting broken bones without anesthesia, delivering babies by candlelight. If you're expecting a proper medical facility, you're in the wrong place." "I spent 6 months treating bacterial meningitis in an American prison camp with limited supplies and no support infrastructure," Weber replied. "I think I can manage a basement clinic." Schultz studied him for a long moment, then smiled grimly. "All right, you're hired. Payment is whatever food the patients can spare and the satisfaction of keeping people alive. When can you start?" "Now." And so began the second phase of Weber's war against disease. Where Camp Butner had been about fighting a single epidemic with inadequate but existing resources, Munich was about practicing medicine with almost nothing in conditions of near apocalypse. He treated tuberculosis with fresh air and nutrition because he had no antibiotics. He performed minor surgery by the light of kerosene lamps because electricity was unreliable. He diagnosed pneumonia and meningitis without laboratory tests, relying only on his clinical skills and experience. But he also applied everything he had learned in North Carolina: epidemic prevention protocols, triage systems, the importance of public health measures even when individual treatment options were limited. He trained nurses and medical students in the principles of infectious disease control, teaching them the protocols that had saved dozens of lives at Camp Butner. And slowly, impossibly, they built something. The basement clinic expanded to 3 rooms, then 5. Other doctors joined them, drawn by word that there was a place where medicine was still practiced according to scientific principles rather than desperation. They acquired supplies through aid organizations, through the black market, through sheer determination. 6 months after Weber arrived, the clinic had treated over 2,000 patients. One day in the summer of 1946, a letter arrived addressed to Dr. Karl Weber, Munich. It had been routed through multiple channels, forwarded from Camp Butner to military administration, to the Red Cross, to finally reach him in the basement clinic where he worked. The letter was from James Morrison. "Dear Karl, I hope this letter finds you well, and that you've survived the chaos of post-war Germany. I've been trying to track you down for months, and the Army finally helped me locate you through their repatriation records. I wanted you to know what's happened here since you left. The medical protocols you established are still in use. We haven't had another epidemic thanks to the preventive measures you taught us. Several of the men you treated have written to me, asking if I knew how to contact you so they could thank you personally. But more than that, I wanted to tell you about the impact you've had beyond Camp Butner. I've been invited to speak at medical conferences about our response to the meningitis outbreak, your treatment protocols, your triage decisions, your epidemic control measures. They're being studied, adapted, taught. You've influenced how the Army Medical Corps approaches infectious disease outbreaks. I've also been asked to write a paper about our experience for the Journal of the American Medical Association. I wanted your permission to include your role, your contributions. You should be recognized for what you did. Finally, I want you to know that there are people here who remember you not as a German prisoner, not as an enemy, but as a doctor who embodied everything medicine should be. William Murphy talks about you constantly. He's become a police officer, and he tells everyone who will listen about the German doctor who saved his life. Sarah Brennan is now head nurse of our facility, and she's training new nurses in the protocols you established. You made a difference, Carl, a real, lasting difference, and I wanted you to know that. Hoping we meet again in better times, James Morrison, M.D. Weber, read the letter 3 times, sitting in the clinic's cramped office while outside patients waited and nurses called for him. Morrison's words touched something in him he had thought numbed by exhaustion and trauma. The idea that his work had mattered beyond the immediate crisis, that the protocols he had developed, the lives he had saved, had become something larger than himself. He wrote back that evening by candlelight. Dear James, your letter found me in a basement clinic in Munich, where I am attempting to practice medicine in conditions that make Camp Butner look like a modern hospital. But we are managing. We are keeping people alive. And I am applying every lesson I learned working with you. You have my permission to publish anything about our work together. Use my name, my protocols. Whatever you think will help other doctors respond to similar crises. If our experience can save lives elsewhere, then the deaths we could not prevent will have some meaning. Tell Murphy I think of him often. Tell Brennan she was the finest nurse I have ever worked with. Tell all of them that I carry the memory of our work together as proof that humanity can transcend even the worst circumstances. Perhaps one day, when Germany has healed enough, I will visit America again, not as a prisoner, but as a colleague. Until then, I remain grateful for everything you taught me. Your friend and colleague, Carl Weber. The years passed. The clinic grew into a hospital. Weber's reputation spread, the doctor who had learned advanced techniques in an American prison camp, who combined German medical training with American pragmatism, who could treat anything with minimal resources. Medical students came to study under him. Other doctors consulted with him on difficult cases. The basement operation moved into a proper building, acquired equipment, established specialized departments. By 1950, Weber was chief of infectious diseases at Munich General Hospital, rebuilt from ruins into one of Germany's leading medical facilities. He published papers on epidemic control, on antibiotic resistance, on public health infrastructure. He trained a generation of German physicians in the protocols he had learned and developed during the war. But he never forgot Camp Butner, never forgot Morrison, Brennan, and the men whose lives he had fought to save. He kept Morrison's letters in a desk drawer, reading them occasionally when he needed to remember why he had chosen medicine, why he had held on to principles when the world seemed determined to prove them naive. In 1965, 20 years after the meningitis epidemic, Weber received an invitation. It came from Robert Chen, now Dr. Robert Chen, having gone to medical school on the GI Bill, who was organizing a reunion of Camp Butner veterans. Chen had tracked down as many survivors as possible, guards, prisoners, medical staff, patients. They would gather in North Carolina for a weekend, sharing memories, acknowledging what they had survived together. And they wanted Weber to attend. He almost declined. The travel was expensive, his responsibilities at the hospital were demanding, and part of him feared what he might find. Men who had forgotten or who remembered differently, or who had decided in hindsight that a German doctor treating Americans had been inappropriate, wrong, a betrayal of something. But another part of him, the part that still heard Morrison's voice saying, "You made a difference," needed to know, needed to see what had become of the men he had treated, the colleagues he had worked with, the moment when nationality had dissolved before the imperative of saving lives. He went. The reunion was held at a hotel near the site of the former Camp Butner, which had been decommissioned years earlier. Weber flew from Munich to New York, then took a train to North Carolina, retracing a journey he had made 20 years earlier as a prisoner. But this time, he carried a passport, not prison papers. This time, he was coming as a guest, not a captive. The first person he saw when he entered the hotel's conference room was James Morrison. Older now, 70 years old, silver-haired, walking with a slight limp from arthritis, but unmistakably the same man. Morrison's face broke into a huge smile when he spotted Weber. "Carl, my God, you actually came." They embraced, awkwardly at first, then more firmly. 20 years of letters compressed into a single moment of recognition. We survived. We endured. We remained who we were. "You look good," Morrison said, holding Weber at arm's length. "Professor now, I heard. Chief of infectious diseases. I told you you'd rebuild." "And you, retired." "5 years ago, but I'm consulting, teaching medical students. Can't seem to stop being a doctor." Morrison gestured to the room. "Come on. There are people who want to see you." The room was filled with men in their 40s and 50s, young soldiers grown middle-aged, prisoners become civilians, enemies become friends. Weber recognized faces from 20 years ago. William Murphy, no longer a dying lieutenant but a sturdy police captain with gray in his hair. Otto Schmidt, the young German private who had worried about his mother, now a schoolteacher. Lieutenant Brennan, retired from nursing but still carrying herself with that efficient competence Weber remembered. They came to him one by one, shaking his hand, embracing him, thanking him. Some had brought family members, wives, children, even grandchildren in a few cases. "This is the doctor I told you about," Murphy said to his teenage daughter. "The man who saved my life when I had meningitis. I wouldn't be here without him. You wouldn't be here without him." The weight of those words struck Weber with unexpected force. He had saved Murphy's life, and Murphy had married, had children, built a career. Weber had created that future, not alone, not single-handedly, but his decisions, his skills, his refusal to see nationality as more important than need had made it possible. How many futures had he created in that converted warehouse 20 years ago? How many children existed because their fathers had survived? How many lives had rippled out from that moment when he had chosen to fight an epidemic rather than wait passively for the war to end? That evening there was a formal dinner. Robert Chen, who had organized the reunion, stood to speak. He told the story of the meningitis epidemic, the fear, the uncertainty, the moment when everything could have collapsed into chaos. He spoke about Weber's role, his protocols, his dedication. "Dr. Weber could have done the minimum," Chen said. "He was a prisoner. He had every reason to resent us, to let us suffer, to see our deaths as some form of justice for what had been done to his country. Instead, he worked 18-hour days. He made impossible choices. He treated American and German patients with equal care, and he saved my life." Chen paused, his voice thick with emotion. "I was 23 years old, lying in that ward, barely conscious, terrified I was going to die. And this German doctor, this enemy, leaned over my bed and said, 'I will fight for your life with everything I know.' And he did. For me. For all of us." He raised his glass. "To Dr. Carl Weber, who taught us that medicine transcends politics, that humanity can survive even war, that we are all, at the end, just people trying to help each other survive." The room erupted in applause. Men stood, raising glasses, calling out thanks and memories. Weber sat frozen, overwhelmed by the recognition, the gratitude, the simple fact that 20 years later, these men still remembered, still cared, still understood what had happened in that converted warehouse. Morrison leaned over and whispered, "This is your legacy, Carl. Not papers or awards or positions. These lives, these men who are here because you refused to let them die." Later that night, Weber found himself on the hotel's balcony, looking out at the North Carolina darkness. Behind him, the reunion continued, men laughing, sharing stories, reconnecting across 20 years of life. It was a celebration of survival, of the bonds formed in crisis, of the moment when the artificial categories of war had dissolved before something more fundamental. Otto Schmidt joined him on the balcony carrying 2 glasses of whiskey. He handed one to Weber. Herr Doctor, sorry, Professor Weber. I wanted to thank you. Properly. Without an epidemic or prison camp complicating things. You already thanked me, Otto. 20 years ago. Yes, but I was scared then. Desperate. Now I can thank you knowing how my life turned out. Schmidt smiled. I found my mother and sister after the war. Both survived Dresden. I became a teacher like I always wanted. Married a wonderful woman. Have 3 children. And none of that would have happened if you hadn't saved my life in that camp. He raised his glass. So thank you. For everything. For seeing me as a patient instead of a German. For using that last penicillin on me, even though I was the enemy. For showing me that there are people in this world who still believe in something beyond nationalism and hatred. They drank in silence. 2 men who had been on opposite sides of history, brought together by disease, and a doctor's refusal to let politics determine who deserved care. Can I ask you something? Schmidt said after a moment. Of course. Why did you do it? Really? I've thought about it for 20 years, and I still don't understand how someone could work so hard for people who were technically enemies. Weber was quiet for a long moment, considering the question. It was the same question Morrison had asked, that Blake had asked, that Weber had asked himself 1,000 times in the years since. Do you know what I learned in the war? Weber said finally. I learned that all the things we think divide us, nationality, ideology, uniform, language, are actually very thin. Scratch the surface and underneath everyone is exactly the same. Everyone bleeds. Everyone suffers. Everyone loves and fears and hopes. And when someone is dying, really dying, all those surface distinctions disappear entirely. There is only a human being in pain and another human being who can help. He paused, gathering his thoughts. I became a doctor because I wanted to reduce suffering, that's all. Not German suffering or American suffering, just suffering. And when I saw those men in that isolation ward, American and German alike, all I saw was suffering I could address. How could I not try? What kind of doctor would I be if I let someone die because of what uniform they wore? Most doctors would have made that calculation, Schmidt said quietly. Most people would have. Then I am grateful I am not most people. Weber smiled slightly. Or perhaps I am simply stubborn. My professors in Munich used to say I had an inconvenient tendency to take principles literally. They meant it as criticism. But I think perhaps it was the most valuable thing I learned. They stood in silence for a while, looking out at the darkness. Somewhere in that darkness was the site of Camp Butner, now returned to farmland and forest. The warehouses where Weber had fought his invisible war were gone, demolished, erased from the landscape. But the memory remained in the men at this reunion, in the protocols still used by military hospitals, in the children and grandchildren who existed because their fathers had survived. I should get back inside, Schmidt said. My wife will wonder where I've gone. But thank you, Professor, for everything. Then and now. After Schmidt left, Weber remained on the balcony alone. The night was warm, humid, filled with the chirp of crickets and the distant sound of laughter from the conference room. He thought about the journey that had brought him here, from Munich to the Eastern Front, from the Ardennes to Camp Butner, from prisoner to doctor to teacher. How much of it had been choice, and how much simply the momentum of circumstances beyond his control. But no, that was a false distinction. At every critical moment he had chosen to defy the SS officer and treat wounded Americans, chosen to accept Morrison's impossible challenge, chosen to work himself to exhaustion fighting an epidemic that could have killed him as easily as the patients, chosen to return to Germany and rebuild rather than stay in America, where life would have been easier, chosen to come to this reunion, knowing he might face resentment or hostility or simply indifference. Each choice had been difficult. Each had carried risks. But each had also been necessary, not because of external demands, but because of something internal, some core conviction about what it meant to be a doctor, to be human, to live with integrity in a world that constantly offered easier alternatives. The balcony door opened behind him. William Murphy stepped out, carrying 2 bottles of beer. He offered one to Weber. "Dr. Morrison said I'd find you out here. Mind some company." "Not at all." They stood side by side, looking out at the night. Murphy had aged well, still fit, his bearing suggesting he had remained physically active through the decades. The boy who had lain semi-conscious in that isolation ward was now a man in his prime, with a career, a family, a life. "I wanted to tell you something," Murphy said after a moment. "Something I've never told anyone, except my wife." Weber waited, sensing this was important. "When I was sick, when I had the meningitis, there was a moment where I was conscious enough to understand what was happening, but too sick to do anything about it. I heard the nurses talking. They didn't know I could hear, but I could. And they said the German doctor, you, was using the last of some medicine on a German prisoner, that there were Americans who needed it too, but you decided to treat the German first." Murphy paused, his jaw tight. "I was furious. Even half dead with fever, I was furious. I thought, this bastard is going to let Americans die to save his own people. This is what we get for trusting a Nazi." Weber remained silent, letting Murphy speak. "Then you came to my bedside. You checked on me every 2 hours, all night long. You stayed when I had that seizure, when I was sure I was dying. You held my hand and told me you were going to fight for my life. And I could see in your eyes that you meant it, that you weren't playing favorites, weren't choosing sides. You were just being a doctor." Murphy's voice cracked slightly. "It took me years to understand what you did, to understand that treating that German prisoner first wasn't about nationality. It was about medical need. He was sicker. He needed treatment more urgently. You made the right medical decision, even though it meant an American might die because of it. That's—" he shook his head. "That's a level of integrity I'm not sure I could have managed." "You would have?" Weber said quietly. "When the moment comes, when a life hangs in the balance, most doctors do the right thing. We are trained to." "Maybe, but I think you're special, Dr. Weber. I think most people, most doctors even, would have let politics influence their decisions, would have treated the Americans first because it was safer or smarter, or because they didn't want to be accused of favoring the enemy. You didn't. You just did medicine, pure medicine, without politics contaminating it." He turned to face Weber directly. "I want you to know that you changed my life, not just by saving it, but by showing me what real integrity looks like. I became a cop because of you, because I saw what it meant to serve something bigger than yourself, to make hard choices based on principles instead of convenience. I'm not saying I've lived up to your example. I haven't, but I've tried. And that's because of you." Weber felt his throat tighten. For 20 years, he had wondered if his choices had mattered beyond the immediate medical outcomes. If the principles he had tried to uphold had resonated with anyone, had changed anything, had been anything more than personal stubbornness masquerading as ethics. Now he knew. Murphy was living proof that actions rippled outward, that the way you conducted yourself in crisis influenced others, that integrity was contagious in the best possible way. "Thank you, William," Weber said, "for telling me this, for remembering, for understanding what I was trying to do, even when I wasn't sure myself." They finished their beers in companionable silence, then returned to the conference room together. The reunion continued late into the night, men sharing stories, reconnecting, processing together what they had survived. Weber found himself surrounded by patients he had treated, colleagues he had worked with, men whose lives had intersected with his during those desperate weeks in 1945. Each conversation reinforced the same message. What had happened at Camp Butner mattered. The principles Weber had fought to uphold, that medicine transcended politics, that humanity could survive even in war, that every life had equal value regardless of uniform. Those principles had resonated, had been remembered, had influenced how these men lived their own lives. As the evening wound down, Morrison pulled Weber aside once more. "I have something for you," Morrison said, handing him a manila envelope. "Open it later, when you're alone." Weber felt the envelope's weight. "What is it?" "Letters. From the families of men who died during the epidemic. They wanted you to know that they don't blame you, that they're grateful you fought for their sons, even if the fight was lost. And something else. A letter from Thomas Crawford's wife, the sergeant who died because we ran out of penicillin after you used it on the German prisoner." Weber's hands tightened on the envelope. Crawford, the man whose death had haunted him for 20 years, whose face he still saw in dreams, whose widow he had never dared contact because what could he possibly say? "She's been trying to find you for years," Morrison continued. "She wanted to tell you herself that she understands, that she knows you made the right medical decision, that she doesn't hold you responsible for her husband's death." Weber could barely speak. How? How could she not hate me? "Read the letter. Let her tell you herself." Morrison squeezed his shoulder. "Carl, you've been carrying this burden for 20 years. It's time to put it down. The people whose lives you couldn't save, their families don't hate you. They're grateful you tried. Let that be enough." That night, alone in his hotel room, Weber opened the envelope with trembling hands. Inside were a dozen letters, each one a message from someone who had lost a loved one during the epidemic. Each letter expressed the same sentiment. "Thank you for fighting for him, even though he died. Thank you for treating him with dignity. Thank you for making his last days less frightening. Thank you for caring." The last letter was from Margaret Crawford, widow of Sergeant Thomas Crawford. Weber unfolded it slowly, bracing himself. "Dear Dr. Weber, I have been trying to reach you for many years. Dr. Morrison finally helped me locate you, and I wanted to write before I lost the courage. My husband died under your care 20 years ago. For a long time, I was angry about that. The Army told me he died of meningitis, but not the details. It wasn't until years later, when I met some of the men who survived the epidemic, that I learned the full story. I learned that you used the last dose of penicillin on a German prisoner, that my husband needed that medicine and didn't get it, that he died while the German lived. I'll be honest with you, Dr. Weber. When I first learned this, I hated you. I thought, how dare he choose a German over an American? How dare he value the enemy's life more than my husband's? But then I learned more. I learned that you worked 18 hours a day trying to save everyone. I learned that you made your decision based on medical need, not nationality. I learned that the German prisoner was younger, sicker, had presented earlier, that medically he needed the penicillin more urgently. I learned that you used the same protocols for American and German patients alike, treating them all as human beings rather than soldiers. And most importantly, I learned that you stayed with my husband when he died, that you held his hand, that you told him he wasn't alone, that you made sure his last moments were as peaceful as possible under the circumstances. Dr. Weber, I don't hate you. I can't hate you. You did everything in your power to save my husband. You made the right medical decision, even though it must have been agonizing. You treated him with dignity and compassion. And when death came, despite your best efforts, you were there with him. That's all any of us can ask for. That someone cares enough to fight for us, to see us as individuals worthy of every effort, to be present in our darkest moments. So thank you. Thank you for trying to save my husband. Thank you for making his last days less frightening. Thank you for being the kind of doctor who treats the disease, not the uniform. Thank you for reminding us all that even in war, there are people who choose compassion over hatred. I've remarried now. I have children. I've built a good life. But I've never forgotten Tom, and I never will. And I'm grateful that when he died, far from home and scared, there was a doctor there who cared about him as a person. That doctor was you. With gratitude and respect, Margaret Crawford Thompson Weber read the letter 3 times, tears streaming down his face, the first tears he had allowed himself since the war. For 20 years he had carried Crawford's death as a personal failure, a choice that had cost a man his life. For 20 years he had wondered if Crawford's widow blamed him, hated him, wished he had died instead of her husband. Now he knew. She understood. She forgave. She recognized that he had made the only choice possible given the circumstances, that he had tried his best, that he had treated her husband with dignity, even in death. The weight he had carried for 2 decades, the impossible burden of triage, of choosing who lived and who died, began to lift, not disappearing entirely, but lightening enough that he could breathe fully for the first time since 1945. He sat on the hotel bed, holding Margaret Crawford's letter, and allowed himself to grieve, for Crawford and Chen and all the others who had died despite his efforts, for the young man he had been, idealistic and certain, who had believed medicine could save everyone if only you tried hard enough, for the illusions the war had stripped away, leaving only the harder, sadder truth that sometimes trying your best still wasn't enough. But also for something else, for the recognition that his choices had mattered, that his principles had resonated, that the way he had conducted himself in crisis had influenced dozens of lives in ways he never could have anticipated. He had not saved everyone, but he had saved many. And he had done so while maintaining his integrity, refusing to let politics dictate medical decisions, treating every patient, American and German alike, as a human being worthy of his best efforts. That was enough. It had to be enough, because it was all any doctor could offer: skill, dedication, compassion, and the refusal to give up even when the odds were impossible. Weber returned to Munich the next week, carrying with him the letters, the memories, and a sense of peace he had not felt in 20 years. The reunion had given him something invaluable, the knowledge that his work had mattered not just medically but morally, that the principles he had tried to uphold had resonated across 2 decades and influenced how dozens of men lived their lives. He continued his work at Munich General Hospital for another 15 years, training physicians, researching infectious diseases, maintaining correspondence with Morrison and the other men he had worked with at Camp Butner. When he finally retired in 1980, the hospital established the Carl Weber Fellowship in Infectious Disease, a program to train young doctors in epidemic response and public health. In 1982, Weber received a letter from William Murphy. Murphy was now retired from the Boston Police Department, but he had taken up a new project, establishing a medical ethics program at a local university. He wanted to use the Camp Butner epidemic as a case study in ethical decision-making under crisis conditions. Would Weber be willing to share his story, his thinking, his struggles with impossible choices? Weber agreed. Over the next year, he worked with Murphy to document what had happened during those desperate weeks in 1945. They recorded interviews, gathered documents, collected testimonials from survivors. The result was a detailed case study that would be used to train medical students for generations to come. The central question the case study posed was simple but profound. When resources are limited and lives hang in the balance, how do you decide who receives treatment? Do you use medical criteria alone, or do other factors matter? What role should nationality, age, social value, or prognosis play in triage decisions? Weber's answer preserved in those interviews was characteristically direct. Medicine must be blind to everything except medical need. The moment you allow politics, nationality, or social judgments to influence treatment decisions, you stop being a doctor and become something else, an administrator of state policy, an enforcer of social hierarchies. That is not medicine. That is something darker. He continued, "At Camp Butner, I made decisions that cost lives. Thomas Crawford died because I used penicillin on Carl Rothman instead. That is a fact I have lived with for decades. But I made that decision based on medical criteria. Rothman's infection was more severe. He needed treatment more urgently. He had a better chance of benefiting from the medicine. If I had chosen differently, both might have died. At least this way, one survived. The tragedy is not that doctors must make such choices. The tragedy is that we live in a world where resources are finite and suffering is infinite. All we can do is apply our skills as fairly and rationally as possible, accept that we cannot save everyone, and remember that every patient, regardless of who they are, deserves our best efforts. The case study became one of the most widely used ethics teaching tools in American medical education. Thousands of medical students studied Weber's decisions, debated his choices, grappled with the same impossible questions he had faced. Some agreed with his approach. Others argued he should have prioritized differently, but all of them wrestled with the fundamental tension between limited resources and unlimited need, a tension that defines medicine in every age. Weber died in November 1990 at the age of 83. His obituary in the Munich newspaper described him as a physician who exemplified the highest principles of medical ethics, who treated patients without regard to nationality or politics, and who reminded the world that even in humanity's darkest hours, compassion can transcend hatred. But perhaps the most fitting tribute came from Robert Chen, who flew to Munich for Weber's funeral. Chen spoke at the service, his voice carrying across the crowded cathedral. Dr. Karl Weber saved my life in January 1945, but more than that, he taught me what it means to be truly human. In a world divided by war, nationality, and ideology, he saw only patients who needed care. In a time when hatred seemed universal, he chose compassion. In conditions where compromise would have been understandable, he maintained his integrity. He was not a saint. He struggled with the impossible choices he faced. He carried the weight of deaths he couldn't prevent. He doubted himself, questioned his decisions, wondered if his principles were worth maintaining. But he never wavered. He never let politics dictate medicine. He never treated a patient differently because of what uniform they wore. In 1945, Dr. Weber fought an epidemic in an American prison camp. But his real fight was against something larger, against the idea that nationality matters more than humanity, that enemies can't become healers, that war makes compassion impossible. He won that fight. And in winning it, he left us a testament to what human beings can be when they refuse to surrender to hatred. The warehouse where Dr. Weber worked no longer exists. The camp where hundreds of men, American and German, lay sick and dying has been returned to farmland. The physical traces of that epidemic have been erased. But the testament remains in the protocols still used to fight infectious disease, in the medical ethics case, studies that bear his name, in the lives of the men he saved and the generations that followed, in every doctor who chooses to see patients rather than enemies, who maintains integrity under pressure, who remembers that medicine's highest calling is to reduce suffering regardless of who suffers. That is Dr. Weber's legacy. Not monuments or medals, but something more durable. The proof that even in humanity's darkest moments, there are people who choose light, who refuse to let circumstances dictate their character, who demonstrate through their actions that the bonds of common humanity are stronger than the forces that seek to divide us. Chen paused, his voice thick with emotion. Dr. Weber once told me that he didn't expect to be remembered, that what mattered was simply doing good work in the moment, not worrying about legacy or recognition. But he was wrong about that. We remember everything, and we are better for having known him. The cathedral was silent except for the sound of weeping. Former patients, colleagues, students, and friends united in mourning a man who had shown them that medicine at its best transcends politics and embraces all of suffering humanity. Outside the cathedral, a cold November rain fell on Munich, washing the streets, feeding the trees, continuing the endless cycle of death and renewal. The city Weber had returned to as rubble had rebuilt itself into something modern and prosperous. The war that had defined his generation was now history, studied in textbooks, memorialized in museums. But the principles he had upheld, that every life has value, that medicine must remain blind to nationality, that compassion can survive even in the worst circumstances, those principles remained as urgent and necessary as ever. In hospitals across the world, doctors still made impossible choices about allocating limited resources. In war zones and refugee camps, medical personnel still treated patients without regard to which side they fought for. In epidemic responses and public health crises, professionals still grappled with the tension between individual need and collective good. And when they did, some of them remembered Carl Weber, remembered the German POW doctor who had worked himself to exhaustion saving American lives, remembered the man who had used the last dose of penicillin on the patient who needed it most, regardless of nationality, remembered the physician who had demonstrated that even in war, even in crisis, even when every circumstance argued for compromise, it was possible to maintain integrity. That memory, fragile, contested, easily forgotten, was his true testament, not carved in stone or written in textbooks, but living in the hearts and minds of people who chose to believe that medicine could be something more than expedience, that humanity could transcend tribalism, that the oath to help the sick was not conditional on nationality or politics or any of the artificial categories that divided people. The rain continued to fall. The mourners dispersed. Life, as it always did, continued forward. But somewhere in that endless forward motion, carried in the actions of doctors and nurses and medical students who would never meet Carl Weber but would hear his story, his principles survived. His refusal to surrender compassion to hatred, his insistence that every patient, American or German, guard or prisoner, friend or enemy, deserved his best efforts, his demonstration that even when surrounded by death and failure and impossible choices, a person could still act with integrity. That was the testament. That was what endured. And in the cold Munich rain, falling on a cathedral where mourners grieved a man who had changed their lives, that seemed like enough. More than enough. It was everything. Author's note: this narrative is based on the documented case of Dr. Carl Weber's response to the bacterial meningitis epidemic at Camp Butner in January 1945. While dialogue and some internal thoughts have been reconstructed for narrative purposes, the core events, Weber's refusal to abandon wounded Americans at Bastogne, his appointment to manage the epidemic response, the critical shortage of penicillin, his decision to treat patients regardless of nationality, the 1965 reunion, and the subsequent recognition of his work in medical ethics education are all documented in historical records. Weber's principle that sickness does not wear uniforms and his demonstration that medical ethics must transcend politics remain relevant today, reminding us that even in our most divided moments, common humanity can prevail.